Thank you so much, Mr. Harkaran Singh Sahni, for joining. Let's get started directly into the questions. So the first thing that I just wanted to understand from you is more about yourself. What made you to choose healthcare and patient care in general?
Yeah. So thank you so much, first of all, for giving me this opportunity to be a part of this discussion. Honestly speaking, if you ask me about myself, I have around 17 years of work experience, especially into the domain of customer services. I have 7 years of experience with healthcare. Currently, I'm working with Apollo as the head of service excellence. Before that, I worked with Medanta again in service excellence division. I have myself handled operations for one of the hospitals of Fortis, where I was completely lost into the day-to-day operations. This is on the healthcare side. Before that, I have spent 10 years with telecom. It's a complete shift which I did, or I would say that God blessed me with this. And honestly speaking, telecom was a very fast-paced moving industry as compared to the healthcare. But yes, when it comes to the hospitality side of it, or when it comes to the patient experience side of it, hospital, obviously we really need to work around a lot of things to ensure and deliver great customer services on the ground. Now, when I was in telecom, I was completely responsible for the customer experience, I would say. Along with, I have myself handled the call center operations. I have handled myself the retail operations of stores and mini stores, where I was responsible for both the P&L, the sales and marketing, as well as the customer services. So it's about elevating the customer experience and then trying to upsell something to the customers to enhance the experience overall. So this is about myself. I'm into this customer service domain from last 17-18 years now. When I talk about patient experience, the second part which you just mentioned, why customer experience or patient experience is important. See, customer experience is one thing which I would say that every customer is a king, and then that's so true. It's a very cliche, I would say, line, but yes, end of the day, it is very important. When I talk about patient experience, one thing which I really want to mention here is your patient can't measure the quality of clinical care, that's for sure, but they can definitely measure the quality of experience you are giving or delivering to the patient. So that becomes very important. We really need to understand how and what way we can do further to improve the patient experiences, especially at the last mile. Now, why it is important? Customer experience, as we all know, the customer is the king. So whatever the industry is, whether it is your hospitality, whether it is your hotels, airlines, your telecom, or even the healthcare, everything revolves around your patient experience or customers. So end of the day, we all are working towards the patient for the customers and to enhance their customer experience, patient experience. Definitely, this is the prime agenda. And if customer is the king, why not to work around their experience and enhance their experience? So that is why I have chosen this industry, and I have chosen this as particular domain to work on. And in the last few years, I've done a lot in terms of improving patient experience across all the touch points, which I'm going to talk about during the discussion.
That's great. So as you said, your experience across various industries and service industries, right? I would say has definitely been, again, in the healthcare also being very service oriented. I'm sure that those best practices maybe would have been transfused over here as well. The other set of questions I had was regarding to the functioning of the patient experience as such in hospitals. So the patient experience department, what are the key objectives, and how is the reporting? What's the kind of a role that one has in patient experience side? Could you probably elaborate a bit more on that?
I will certainly do that. So first of all, we really need to understand why customer service or patient experience is very important in healthcare. So as we all know, and then in last 3 years, I've seen a lot of shift, a lot of change happening in the healthcare sector. One interesting fact which I would like to share with you is there was a survey I was reading. I keep reading a lot of journals and the posts which come across, especially on the patient experience side. One thing which really gave me a kick was that around 53% of our patients, they actually value great customer service in healthcare. So that's a huge number. Obviously, a patient who's coming to healthcare or a hospital, it's the prime need is to be well, get the treatment done, and then again be on their feet and move forward in the life. But that is not enough. So in today's world, in the changing world, we have seen around 53%, and it has come out of a survey which was conducted not in India but globally. So if what I personally feel, if you satisfy one patient, he will definitely get you 4 more patients. But if you eliminate one patient, that will reach at least 10 potential patients of yours. So we need to first of all understand this fact. Now, once we understand this fact, it becomes, I would say, it's not a luxury. It's a necessity for a hospital to make sure that a patient experience is taken care of. And we have, especially in Apollo, we really look forward to touch lives in every aspect of it. Starting from when you make call and ask for an appointment, till the time you are discharged, or even post-discharge, we keep in touch with the patient to ensure that yes, he is a part of Apollo family group and we are taking care of him. Now, how that functioning happens is very important. Every hospital comes up with a service excellence team. Every hospital is working towards patient experience, and they have a dedicated team on the ground who acts more or less as a patient advocate. So when I mean a patient advocate here, at times they stand against the process, but in the betterment of the patient. Anything which is good for my patient, my team will stood there and they will make sure that the thing or the requirement is made. And even if required, we are requested to or required to make changes in our processes, we would love to go ahead and do that. And we have done, especially in last couple of years, we have improved a lot of processes to ensure a smooth patient experience on the ground. And that's only possible because of the team on the ground there. So this patient experience team, they work very closely with the operations, and they work very closely with the medical admin team, with the doctors on the ground, and make sure any requirement which is there, which needs to be fulfilled, they go ahead with the beyond the call of the duty. They go ahead and take the call, take the decision, get the decisions approved across various levels, and make sure our patients walks out of the hospital happily with a smiling face. And that's how, and I would really love to comment here, the kind of patient experience I have seen in Apollo. That is the reason I would say that why Apollo is leading the healthcare in India, and then it's not in India, in fact now globally also. And this is only possible because of the team there on the ground.
Absolutely. And I think you touched upon also about the fact that over the last couple of years, there have been a lot of things in terms of processes, changes, and additional enhancements and all.
That's right.
What has your been experience, and can you probably explain some of the best practices that has come out, some of the things that you have done over the past 1-2 years in this regard, in the patient experience side?
Yeah. So one thing which I would really talk about is pandemic. I knew that everybody nowadays talks about pandemic, and we call it a new normal, but I honestly feel that this shift or this change was very much required. How pandemic has improved our overall thought process or overall experience One is that a lot of people, I personally know in my families as well, where they have actually made that shift towards the technology. People who were not tech savvy, now they are on, they're using different applications on the mobile. In fact, I would say my parents, my grandparents, I have seen them how they are actually moving towards this shift and how they are getting adapted towards this technological piece. Now, when I talk about technology, yes, healthcare is one area, or I would say one industry who works very closely. A lot of technology interventions we want to get into, and we have seen in last, especially post COVID, a lot of new digitization ideas that have come up, which have improved our patient experiences on the ground. So that shift, I think, that has played an important role, and whatever happens for good. That I truly believe in this statement, and that's why this pandemic, I would say, I will see always the positive side of this, and this pandemic has taught us a lot of new things. So that is what I personally feel.
Yeah. We have seen, of course, specifically if you look at past 1.5 years, the adoption, say for example, to teleconsultations, right? That's been immense, and I think even now that we are seeing that the adoption is quite healthy. Any specific examples that you have seen, or with let's ask, like, any specific technology solutions that you're really excited about, that you're looking at for in the coming future in around patient experience?
So as a service excellence lead, I work very closely with the ops team, and honestly speaking, we ops and I in the IT team. Especially in Apollo, we have launched various initiatives which have improved patient experience with the help of the technology. I was just talking to you a few complete shift of this technological solution when we work with the IT team. So a lot of new interventions, or not a lot of new solutions they have brought in. So we work very closely with the operations team to make sure those applications are utilized on the ground effectively. One of the best solutions, or I would say best practices, which I personally feel one of the award-winning practice which Apollo launched during pandemic was a patient communication app. We launched this application. We all knew that our patients are actually admitted during COVID, and nobody can get in touch with that patient. They are completely into isolation. Only the nursing, the warriors, they were taking care of the patients at that point of time. Even the family members were not allowed. So, but end of the day, if my family member is admitted, and I have seen this during pandemic, we really, it was the anxiety, or I would say the panic attacks which I have seen in people, in the attendants, because they really want to get in touch with their patient, know how the situation is, how their health is. So to enhance the communication bit of it, we launched this patient communication app, and in this app, how it works is, as soon as your patient is admitted, a link goes to the attendant. He can just simply click on that link, open it up, and see how his patient's doing. So we keep updating patient's vital information there, and he can interact with the hospital staff. He can just send any query which he has related to patient's health, or he wanted to know anything about the patient condition. He can just type in a question, and we will respond back to his questions immediately. So there were compliances on the TAT on at every level. Apart from that, we also made sure that if a patient attendant wants to get in touch with the treating doctor, he can request for a video call through the same application, and he can get in touch with the doctor and do a video consult immediately. So it's like, I know my family member is in the hospital. Now I have this liberty, I have this privilege to get in touch with the treating doctor over a video call. And I think that is what one key differentiator I have personally seen, or the best practices which I am so proud of that we launched during COVID. These are small initiatives. This is one of the initiatives which I am talking about. There are thousands of such initiatives which we are already working on. So please, we can definitely have, if I'm going to talk more about those initiatives. This session will go on and on and on. So we'll definitely talk in bits and pieces about those initiatives. So for example, we launched paperless registrations. We launched paperless billing. We have an option of self-billing in the hospital, where a patient need not to go to a billing counter. As soon as the consult is done, he need to get his investigations billed. He will get a message on his mobile. He just need to simply open that link and then need to and use that same application to do the billing himself. So no need to go to the billing counter, no need to get in touch with anyone. Just simply do the billing, go for your investigation, get your investigation done. So we are trying to ease out how we can improve patient experience, how we can ease out our own processes on the ground, how we can make it more patient friendly so that they know why Apollo is leading and what kind of technology solution Apollo is bringing in to enhance patient experience. So this is one I would say few of the initiatives which I have just spoken about. There are still a lot more, many more in fact in the kitty, which we are currently working upon, and a lot of them are still new initiatives which are still in the pipeline. We are going to launch it soon.
That's really great to hear. And I think again, with of course increasing adoption, and also more people are now aware of some of these solutions across other industries as well. Now even healthcare has adopted many of these and seeing the benefits of it. It's really nice to see that that's been accelerated in the past 1 year or so. My last question to you, Mr. Harkaran, is that where do you see patient experience as a function evolving in the next few years? Already, of course, past 2 years you've seen a lot of disruption, but there's lots more to look forward to, right? So, any thoughts on that?
Yeah. So when I talk about a patient experience, it has both the medical and the non-medical side of it. So medical side of it is obviously we have the best doctor, best clinical talent we have in the organization. So that is taken care by. In fact, the non-clinical side of it, when I talk about, we have the best talent in terms of designing such kind of processes, how we can improve our patient experience. Now, we need to first of all understand what patient experience is consist of. So there are three factors which really impact patient experience, and that again this has come up from one of the study which we have done recently. The three more major important factors is, one is of course the waiting time. Second is of course the cost of the healthcare needs. Third is the communication. So these three plays an important role in the entire patient experience when I talk about. I'm sure there are other factors, but these are the three important, or I would say the major contributors to patient experience. Now, when I talk about the waiting time is at every level. So one again thing which interesting fact which I want to put it across, what I have seen is 84% of people actually believe that waiting time is somewhat important or the very important factor for them to decide upon choosing the hospital or the doctor. So in fact 30% of patients have actually walked out of the appointment due to the long waiting time. So this kind of patient experience nowadays we are experiencing. Now we really want to work towards it. How we can reduce the waiting time in the hospitals. Whether it is starting from booking of an appointment, whether it is through an app or even through the call center. So how we can make the process so easy for the patient that it is just few clicks and you're done, your appointment is booked. So that kind of solution we've already brought in. We already have those solutions. Apollo 24/7 app gives you that liberty to just quickly book the appointment, even quickly book a video consult. You don't have to actually wait for hours to get in touch with a doctor, or maybe as we have seen during pandemic, wait for days to get in touch with the patient. But now we give you a commitment. As soon as you book an appointment, you can even see the waiting time on the application, that how by what time the doctor will get in touch with you. So that's that kind of solutions we are working on, and we are tirelessly working on to improve these on the ground. We are also working towards enhancing the cost. How we can bring the cost down, how we can enhance patient experience, or how we can make the brand value for money for a patient. Because this has come up as one of the important feedback in the feedback collection process which we have a very, I would say, a very important mechanism which gives us so much insight about what patient thinks about the brand Apollo, and we collect feedbacks at every level, at every touch point, and that's how we get to know that what are the pain areas in the hospital and how we can really improve that. Apart from that, the third factor which I talked about is communication. See, communication is very important, whether it is related to your patient condition or your patient disease, your ailment. So it starts from each and every touch point. Even when a patient goes and wanted to meet a doctor, if a doctor is busy, you're waiting for the doctor and nobody's telling you how much time it's going to take, it really ruins the entire experience. So now here the human factor comes in place, where we definitely keep engaging our patients at times. Also, we keep them updated about what is the waiting time, how much time it's going to take, and we also parallelly work with the doctors. In fact, by getting in the solutions like smart scheduling and all, where we can reduce the waiting time, ensure that a proper communication goes to the patient, what time he has to come to the hospital, where he is actually has to go in the hospital. Honestly speaking, when anybody walks into a hospital, it's a huge building. Nobody knows where to go. Okay, you look for signages, you look for people to guide you. But as a patient experience owner, what I personally or entire team personally works upon is, as soon as you book an appointment in Apollo, we will give you the exact room number or the counter number where you need to go and meet the person to get your services. So this kind of solutions we have already built in Apollo, and also not only this, we are also keep enhancing these solutions. We ensure that our communication. One example which I just spoke about is the patient communication app. So you can understand that how communication plays an important role, and how Apollo is taking this very seriously and proactively. We are looking for proactive measures how we can improve the communication piece of it.
Excellent.
So these three important factors of patient experience plays an important role in the entire journey of a patient, and in fact the attendance. So that's how we look forward to. We keep working on with the teams on the ground to improve this. How we measure the success on these parameters is, of course, we have various dashboards to measure the waiting time, the cost, how we are. What estimate was given and how the final bill is. So those kind of estimates we check. The communication part of it, how our new initiatives, how they are launched, how effectively they are being used on the ground. So we have various dashboards. Finally, how after doing all those stuff, how are we actually getting what patients still perceive about Apollo is, we measure it through our NPS. NPS plays an important role. That gives you the real picture, whether the patient is going to really promote your brand to their friends and family. So we have a very foolproof mechanism in place where we take feedback from patients at various levels, work on those feedbacks, come up with various problem-solving projects on the ground. So our patient experience team, which I spoke about, they work hand in hand with the operations team to do a lot of projects in terms of enhancing patient experience. And in the best practices, the best part of Apollo is it's spread across the length and breadth of the country. So what maybe a solution what has worked in Delhi, we immediately pick that up and try to replicate it across other hospitals. Or we generally create a kitty of solution and send it across all our hospitals, so they can immediately pick up the best problem solving solutions, and then they can replicate it across all their processes in the hospital. So this is the beauty of Apollo, I would say. One practice which I really want to talk about, or I would say one initiative which I really want to talk about, that is driven personally by our leadership, by our chairman, by our I would say the entire steering committee, is tender loving care. This is one differentiator which I have seen in Apollo, in this healthcare organization. which I have not seen across in other hospitals, where our guest relations, our service excellence team, our patient experience team, they try to create a wow moment for all our patients. They get in touch with the patients and they try to, any patients who's admitted in the hospital, let's say, my guest relations, obviously they have to meet the patients on a daily basis. Not only guest relations team, in fact, my nursing team, my operations team, my housekeeping team, security, they are the one who actually touch patients' life during the treatment. In fact, doctors, of course, so at times we have seen when we go beyond the call of the duty to create a special moment, a wow moment for a patient. And honestly speaking, we celebrate those moments with our patients. On an average, and I'm so proud of it, that close to out of those 38, 39 hospitals, we are able to do around more than, I would say, 30,000 TLC moments, the tender loving care moments, which we do on a monthly basis. We are on an average, we are touching 30,000 now. We create special stories and we recognize the hard work done by our staff on the ground, and that because they are the torch bearer of patient experience. So we create special moments for them as well. We recognize their hard work, and then that's how this journey is continuing. And I'm sure every month on month they are taking it to the next level. Last year when we started, when we reviewed our tender level care performance, we have done more than 100% what we have done last year. So that's the kind of I would say the zeal, the enthusiasm our team members have, and they drive it on the ground to make sure our patient leave the hospital with a smile. So this is, I would really want to maybe in my next session with you, or I would be able to talk more about this. But this one initiative is very close to my heart, as it is driven directly by our chairman, sir. So I'm so proud and I feel privileged to be a part of the association. Thank you.
That's really excellent. And thank you so much for sharing a lot of insights. When a brand like Apollo, right? I mean, doing these things is really great to see that, and also the nimbleness, agility at which these things are getting implemented. It's really, really nice to see that. And and I think Apollo has always been a torchbearer for the sector, right? And I think in this age and day also, we are seeing a lot of technology-driven initiatives that's helped patients to move. And I really love the focus on the time, the cost, and the communication, right? To make sure that it gives a consistent experience through patients across their journey. Great. Thank you so much for this wonderful session. It was really
Thank you, Midun, for giving me this opportunity to speak about the best practices or how we are driving patient experience at Apollo. And I'm so proud of it. And I'm so proud of the fact that, yes, we are able to touch millions of lives. And honestly speaking, I really want these things should go across other healthcare operators also, so that they can definitely pick up the best practices which are being followed at Apollo. They can replicate there. End of the day, patient experience matters. Any patient anywhere in the world, see, patient means he is not well, he's come to your hospital for a treatment. Your family, and we have seen such cases where families are very, I would say they're very disrupted, they're in pain actually. So how we can ease out their pain, how we can help them, how we can actually touch their life, how we can handhold them. That is what patient experience is for me. We can definitely do a lot of things. We can boast about doing a lot of good practices, but end of the day, when you put a smile on your attendant's or a patient face, I feel that's a victory, that's a win-win situation for my patient and for me. If he is smiling just because of one small act we have done, we have made his life easy, I think my job is done.
Brilliant. Yeah. That's a great closing remark. Wonderful.
Thank you.
Many thanks for coming on. Really appreciate it.
Sure.
Thank you. Yeah. Thanks again.
Same here. Thank you so much, Vidun. Thank you so much, Majid, for all your support. Thank you.